好，我们现在就go over 这个 questionnaire，因为我发现这种问题他问了我们以后，我们回答起来。I'm sorry, I should use English. I forgot. Okay. The first question is, one fall can lead to multiple falls, which is very true.
True.
Yeah, it's true because a lot of times after you fall, there's a lot of functions you can't do. And also you cannot move around or exercise. That makes you weaker. And also the first fall, it depends on how you fell. The first place, it could be because you were out of balance. Then if it happened, that means it will happen again. Anyway, so trying to learn how to balance yourself, do a lot of exercise that can help you do the better balance. Actually, Asian Center offers an exercise program called Mat of Balance, which are just a lot of stretch and movement that we learn through life. But anyway, there's so many different exercises that you can learn to improve your balance. And the second question is, spending time with your family may help reduce risk to your brain. That's true. Yeah, because that's like a social connectivity that you are improving for yourself, and that will help your brain. Medicines may impact your balance. I think we all know that. That's very true, because if you take any sedative medicines, and that may make you drowsy. Even just allergy, sometimes you take the medicine, make you drowsy also. Number 4, exercise and physical activities are the same thing. That's not true, because you can say that exercise is one kind of physical activities, but physical activities, there's a lot of your body move around is just physical activity. But exercise usually is intentionally special designed. The movement usually has a goal. Why do you want to do certain exercise? There's a reason that you will do that. Number 5, falling is inevitable as you age. That's not true. Aging is inevitable, but falling is not. You can learn better balance and prevent from falling. Number 6, you only need to talk to your doctor about your physical health. It's not true, because you need physical health, mental health. All of these are part of your overall health. Emotional health is very important. Number 7, there's nothing you can do to reduce medicine-related problems. That's not true. If there's any problem from medicine, you should talk to your physician, your caregiver, and discuss other alternatives. Number 8, if your blood pressure is high, you'll feel it. That's not true. That's why they call the high blood pressure is a silent killer, silent disease. Number 9, a nightcap will help you get a great night's sleep. Not true. It may initially put you to sleep easier, but after you wake up or in the middle of the sleep, you can easily, the alcohol effect is weared off, and you'll be waking up and probably more miserable. It says that the sedative effect wears off during the rapid eye movement. The rapid eye movement during your sleep is when you have you dream a lot during that period, but not every dream will you remember though. Number 10, the things you do for heart health may help reduce some risk to your brain. That is very true because for heart healthy diet, for example, definitely will help you to keep your brain health as well. When we the next PowerPoint presentation, the slides presentation, we're gonna talk about what makes you keep your brain health. That's one of them is to eat healthy. Number 11, crossword and Sudoku puzzles prevent Alzheimer's disease. If that's all you do to prevent Alzheimer's, that's too easy, right? Because we can all do that. It will help you to keep your brain sharper, but Alzheimer's disease has a lot of other parameters which we really don't know all that well. So it is not true. Just doing these are not enough. Number 12, picking up a creative art may help your memory, which is true. It's partially because if you have a creative art, hopefully you use your brain more often than not, then you will keep your memory better. And one of the brain health exercise is to read more and do more creative things. Number 13, only prescribed meds are dangerous when mixed with alcohol. Not true, we know that. If you take aspirin or Tylenol and then drink, you will have miserable feelings. Number 14, older adults don't need as much sleep as they used to. Not true. Sorry. Don't need, we do need about 7 or 8 hours sleep every day, still the same. Medicine is the only way to control your blood pressure. Not true. You know that if you do exercise, that will help you to keep your blood pressure better. Number 16, vitamins and herbal medicines do not have to be reported to your doctor. Not true. We do want you to tell your doctor everything that you've taken other than the regular food. We talked about that in the last session. Being Chinese, especially, there are all kinds of herbal medicine that we know of and have the tendency to take. Even when I take my ginger tea every day, I tell my doctor that. Number 17, your doctor should determine all of your medical dominate all your medical discussions. Don't let him dominate that. You can discuss with him. You should have some input as you're the patient yourself. You know your body better than anyone else's because nobody can feel what you feel. Number 18, if you haven't exercised in years, it's not safe to start doing that. This is really, really not good answer. You can always start something new. Just be careful. Nobody wants to be a marathon runner starting tomorrow. You will gradually ease into that.
Janilla.
Yeah.
Janilla.
Yeah.
We can only see number 16. You have to move the screen
up. Oh, sorry, I forgot. Thank you for reminding me. See, when you're getting old, you can't multitasking. When I'm talking, I can't see the screen anymore, right? Okay. Doctor, you're 18. If you haven't exercised, I think I mentioned this to many people. I can't remember if I did to you, that 40 years ago when I read an article about retired nuns in a convent, and they were asked to start taking the dumbbell for muscle build. And they used EMG to test the muscle activity and found out 6 weeks later, everybody improved their muscle strength which to them is something unheardable, because you can imagine 40 years ago, sister that's already 80, 90 years old, staying in a county, and they never really exercised all their life. But they started at the age of 80 or 90, they were able to build up their muscle at that age. As you age, you spend less time at home. I think that's not true. And that's also, sometimes probably some people would, but majority people don't really spend, any lesser time at home. Balance exercise may help you to avoid ER. That is very true, because we just mentioned that balance exercise, hopefully you have better balance, you'll have less chance to fall. Number 21, it can be beneficial to take a family member with you to your doctor appointment. It is always true, have a set of extra ear to help you listen to the doctor. These days, if you don't have anyone go with you, you can turn on your iPhone, just record what the doctor says, and come back and you can, study that. Number 22nd, if your weight changes, your reaction to medicine can change too. That's very true. That's one of the questions I always discuss with a surgeon if I meet them. I said that the anesthesia they gave us is usually too strong for Asian Americans. I know they don't like to hear that, but that's the truth. Somebody has does someone just came in, have two devices open or something? We all hear the noise. Okay, it's gone. Please not using two devices in one room, because that's always give us the interference. Anyway, the medication, yeah. And I usually complain that the anesthesia they gave patients in United States are too strong for Asian population, but they don't change that for us. So we still have probably bad reaction to that with many people. 23, high blood pressure is common in older people. That's true. We all know as our artery hardens, we will have a higher blood pressure. 24, not getting a good night's sleep can make you forgetful. Yeah, I suppose it will. That's why getting enough sleep is one of the things that we should do to avoid brain damage, not brain damage, just keep your brain health. 25th, drinking a beer is the same as having a shot of liquor. I guess this will have to ask the people who drink. It's probably about the same effect, so it is true. Buying healthy foods is too difficult and expensive for older adults. I don't think that's true. I think all of us, if we don't have enough, then you can, in the summer especially, just grow some on your own too. But I think most of people, the older people here in this country, have no problem buying fresh veggies. Creativity and wisdom do not automatically decline over time. Right. And actually, wisdom should increase over time, right? As we age more, we learn more, we have experienced a lot more, our wisdom should increase. 28, it's normal for food to taste differently as you age. I do feel that way. I think it's true. But the answer is it's true. I don't know if any one of you feel that way, but start to think about how it used to taste for you, certain your favorite dishes. Drinking moderately means drinking without getting drunk. That's not true. Moderate, the FDA has a definition. What is moderate? Like I think like a one drink a day for women, two for men. I think if you can avoid as much as possible, it's better. Volunteer can be good for your health. Yeah, that is definitely true because when you volunteer, you work, you use your brain, you go out to connect with other people, increase your social connectivity. That is good for you.
Hi, Janilla. For 27, the creativity, does it decrease, decline with age?
Creativity and no.
Just the creativity, the first part.
Creativity and wisdom do not automatically decline over times. That's true. Your wisdom actually
increase, but
right?
the creativity, I feel it might decrease with old age.
No, I do not agree with you. I think if you keep doing things, the creativity is, unless you have dementia or brain damage, why should your creativity be declined? It's probably slower, taking your time, but it can still, because you have a lot more experience. Creativity also can benefit from a lot of experience. So if you have experience, you naturally think about ABC in the past and create a D, which a younger person may not have that. Well, anyway, that's the answer is, let me see, what do they say? A person's creativity, wisdom, and personality can remain constant their entire life. In fact, it's said that we actually become white. Oh, in fact, it's said that we actually become wiser with age. That's what I just mentioned. I think your wisdom definitely increase as you age. But I personally think creativity should be really improve as you age because of the background, the experience. You can remember what happened in the past, and that help you become more creative. That's what I feel too. Okay. Well, if you experience differently, maybe you should think that it's time to start doing more creative things. You will find that you probably have improved your creativity. Try that. Think of different way of cooking a nice dish. Change your recipe, taste differently. Anyway, you can, a lot of creativity, you just think about that and do it. Like I just said, to me, the challenge today is I like to cook faster, taste better, easier. So like I told a lot of people, I like Rachel Ray's 30 minutes meal. 30 minutes, you watch her on TV. It starts from scratch, all done with a complete meal, main course, salad, soup, everything. So I personally think that creativity actually improves a lot with time. Okay, that's my point of view. Oh, Jamie, comment?
Yeah, in the question, I don't see any question try to mention about laughter, whether or not laughter is indication of your cognitive ability. Is there any discussion in any books?
It didn't mention specifically for laughter, but for one thing, it does say that you have to pay attention to your emotion, right? Okay. If you have laughter and you hear it, you're happy, you laugh out loud, I think that's giving your emotion a notch up.
Okay.
That automatically boost your brain health.
Okay,
To
thank
me,
you.
that's,
Thank you.
you know, so but they didn't mention, if you want to be talk to a comedian, they probably put that as #1 importance, which we
Okay.
all know that every day, you know, a laugh a day makes you happier. Okay, so that's the homework we had from last week. Hopefully you'll get a better understanding of what this course is about. Now, the next one is our PowerPoint presentation. If you have any questions, by all means, stop and we can discuss that. And I keep forgetting to remind you that. PowerPoint. Hey, Lisa, do you know why my screen always changed on me, that all of a sudden the line of actions all moved up, and now I can't find my PowerPoint to do the slideshow.
Your PowerPoint is up there already.
I know, but I want a slideshow and I can't reach that, the top part of it.
No, you can use the bottom one. See, by 50% on the bottom, you see by 50%, the one
Oh,
right
just
next
use
to
that
it.
to make
No,
it
no, no.
100%?
Left of 50%, left of 50%.
I know, that's what I'm trying to move.
No, not that.
Oh.
The icon.
Keep going left. Keep going left. Going left.
Left.
Okay.
Yeah. The very next one. No, next one.
Oh,
one.
you mean this
Yes.
one, slideshow? Okay. I got it. I don't know, because usually this the video and participants, all that line is on the bottom. All of a sudden it's moved up to the top one. Okay. I've never used that little icon before, so good thing. Thank you. Okay, this is the brain health part of our seminar.
3:50.
Okay, aging well depends on your genes, your lifestyle, choices, and environment. Even if you are healthy, changes in memory and learning as you age may include more challenge with multitasking, increased difficulty finding words, minor decreases in the ability to pay attention. How many of you feel like you have this? I know I do with all of them, because I used to do a lot of multitasking. Now I found out every time I do that, something screwed up easily. And cannot find the words. That happens quite a bit. Also, the pay attention, I kept thinking that as I age, I do have ADD. Rebecca, you want to say something?
No. I'm just moving around.
I can't. I see. I thought you were moving your hands. So you want to? Okay.
No. Thank you.
However, at any age, you can still improve your skills, learn new things, create new memories, and improve your vocabulary. Yeah, I keep, learning new words and I forget. The same word, I probably look at the dictionary 10 times in, who knows, half year. Anyway, yeah, I say that, but these are things that are true. So this particular PowerPoint came from CDC. I'm sure that they have a lot of important information from the base. Okay, protecting brain health. This is the most important slide of the whole presentation. Okay, keep that in mind. These are the 5 things that tell you how to keep your brain health. The first one is healthy eating, which I don't even want to discuss much here because I know all of you and everybody is expert on healthy eating. The second one is regular exercise. Almost everybody has his or her own exercise regimen, which just keep doing it, whatever you do. I mean, there are different kinds of exercise. We can go into detail too, but I think most of you are doing a great job in that respect. The third one is keeping your brain active. This is what Carrie was asking earlier, your creativity. If you keep using your brain, your creativity will still remain there. You may think that as you age, sometimes you're not as creative as past. That may be because you have too much burden, you're stressed out, or some other reason. At point in time, you cannot actually be that creative as you want to. But in general, you keep using your brain, it will keep it sharp. And one of the things I heard a lot of older people say that, oh, I don't want to learn that, I'm too old. Don't ever say that, please. You're as young as you think you are. Even though at my age, 70-some years old, I still think that sometimes when I go out, oh, I'm walking on the campus, see the young people, I can imagine I used to walk there. I say, I can just pretend I'm still a young person walking down and talk to them. So I think even just make believe will make you young at heart and do more younger people would do. I do believe that if you keep doing that, you will really be more active in your overall being and daily life. The fourth one is social connectivities. That's to keep your emotion health. It is important. The social connectivity, including being with your family members. I know all of us are good grandparents and want to be grandma, grandpa to our grandchildren. Do that a lot. That is partially your social connectivities, okay? So it is very important to occasionally go out with some of your good friends, to have lunch, to have other activity. Women like to shopping, go shopping with someone that you have the same taste, and just do that all the time. These are important ingredients for your daily life, so keep them in mind. The last one is getting enough sleep. As I mentioned, they always say that even at old age, get enough 7 to 8 hours sleep if you can. Try as much as you can to keep that. So just remember, these are the 5 ingredients to keep your brain sharp. Okay, we'll briefly mention that healthy eating, we all know, you eat or drink less sugar, less salt, solid fat, and make more vegetable, fruit, whole grain. Choose the lean meats, fish or poultry. Choose the low or non-fat dairy. Portion size control, and drink adequate fluid. I kept saying that people say at older age you get easily dehydrated, but remember your habit of drinking liquids is probably not much change from young to old. Why do you become more easily dehydrated as you get older? That's because there is another ingredient, whether you will get dehydrated or not. That's your electrolyte in your body. So it is not just the liquid. If you drink a lot of water without the proper electrolyte, it will not retain in your body. So if you drink at this age, sometimes drink a little bit the so-called sports drink, but don't get those that has very high calorie content. That's for the athletes afterwards to replenish their nutrition needs. But for older people, electrolyte, there's plenty other that has electrolyte, but not extra sugar. The most natural one is really the coconut water, which I have learned a long time ago that the coconut water, the ingredients in there is very similar to humans' blood plasma, the liquid part, the clear liquid part of your blood. It's very similar. So if you drink that, it has enough electrolyte to help you retain water. So drink a lot of fluid. Also, make sure it has some the electrolyte in there. The regular exercise, I think you've all seen enough benefit from exercising. Let me tell you one thing that I read while I was preparing for this lecture. I just went on NIH website 2 days ago, and I saw this big sign on their website. It says that exercise actually induce a protein that may reverse age-related cognitive decline. That's such a good thing to have. I don't know how come I did not hear that from the news media, but yesterday I was talking to a group of my college graduates from Taida, and when I mentioned that, one of the guys who's actually the dean for the UC Davis for biochemistry or some department, and he says that's called a REIS or something. I don't have time yet to go to PubMed to find out exactly what this is, but I think that's a very exciting news. You know, if something that can actually help to reverse age-related cognitive decline, then we can help. If we can synthesize, make a synthetic chemical product of this protein, and we can pop a pill and hopefully help us to reduce the cognitive decline, that would be so wonderful. I hope that we can see that in our lifetime. Anyway, the physical exercise, almost like right now, is the best advice you can have for your health. Almost so far, if you're not over exercise, then it's almost like a no disadvantage of doing exercise. And now you know that it can actually help your brain also. And it definitely reduces the risk of diabetes, heart disease, and all these stuff too. It says may improve connections among the brain cells. So do a lot of exercise can make you keep your good, healthy brain. Talk to your care provider if you don't know what kind of activity to start picking up. And join the program that teaches you to do active exercise safely. That is very important. Okay. Keep your brain active. Read books and magazines or play games, do puzzle, play Sudoku, take a class or join a club. Don't ever say that I'm too old to do certain things. You're never too old to do anything if you want to. I keep mentioning that in United States, we really have the advantage. If you take any of the community college offer class, you can take them for free. So if you wanted to start doing painting, you want to start doing creative writing, all these kind of fun, interesting classes that you may wanted to take when you were in college but didn't have time, now you can do it. Still do it, okay? Don't find age as an excuse not to do certain things. social connectivity, people who take part in meaningful activities, they feel happier. It may reduce some health risk, because when you're emotionally happy, we say that you know, your body has all kinds of chemicals in there. Your body will secrete all different kinds of hormones inside too. I'm sorry. So if you if you're happy, your body will secrete certain chemicals that make you healthier. I do believe that. If you're very stressful, your body will secrete some chemicals, make you sad or in a bad mood, and that's affecting your health overall. That's why Jamie was just asking if we talk about the laughter. We didn't specifically, but we all know that when you laugh a lot, and that makes you happier, and your body will secrete different chemicals from when you are sad and depressed. Then you have different chemicals. And that's why psychiatrists exist today, because when you're depressed, there are some chemical imbalance in your body, and they can give you pills to help that. So it is definitely when you're having the social connections make you happier, then that will help you to be more uplifting. Brain health risk. These are the kind of risks that you may encounter in trying to, hopefully, certain things that you can do it yourself to avoid it. Accidents happen. And alcohol, that is something you can try to help yourself. If you like to drink, reduce it to the moderate drinking, or even, you know, you can skip it, then do so. Smoking, we all know that. That's the most proven bad habit. And I'm just happy that none of our friends are smokers anymore. Some medicines or improper use of medicines, these are the things that you definitely can help, because we have mentioned earlier all kinds of medical medicines that can actually affect your brain. So if you have to take them for other health reasons, then, you know, just talk to your caregiver if there's other alternatives or different medicine which will more agree with you. And certain health conditions, yeah, we're going to go over each one. The accidents, exercise to improve balance and coordination, which is the important part. I think somebody just mentioned recently, you know, break the risk, because if you have osteoporosis or not strong bone in certain area, you can get the accident much easier. Wear safety belts and helmets if you riding bike or doing some other things that these may help at times. Take a fall prevention class. Actually, in Asian Center, we offer a Tai Chi for arthritis and fall prevention. This particular Tai Chi exercise is an evidence-based exercise that was proved in Australia, that there's a certain county in the southern part of Australia that the senior has a lot of a falling rate. And then so they asked this doctor who developed this Tai Chi and have him to teach the local people this particular exercise, Tai Chi exercise. And after he taught them for a year, and the falling rate reduced 70%. To me, that's way too good. And I thought even half of it, 35%, will be amazing. So the exercise that they have supposedly really help people doing better balance. And make sure your home is safe. And I think there's a lot of safety features that can be installed in your bathroom, because a lot of bathroom has the ceramic tile, and which when it's wet, it's very slippery and easily get a person falling there. So if you have any need to make sure that you don't have accident at home, there are certain devices hopefully that can help you too. Review your medicine with a healthcare provider, and we have discussed that many times. Have your vision checked, okay? And I think we all do that now. If you have cataract, make sure that you have the doctor check that out. So if it needs surgery, it's a very safe surgery these days. Get enough sleep is one way to avoid accident, because if you have enough sleep, you feel much better and stronger. Alcohol. What does alcohol do to you? Impair communication among the brain cells. So even if you drink one shot, which is allowed, there's still a certain amount of brain damage that's happening whenever you drink. This is something that I, in our notes, and it says here, that's been proven. So even modest way of drinking could, in the long run, may hurt your brain. And I always remember my GI doctor, who is a Muslim, just say there are so many other good way to get that polyphenol. You don't need to get it from wine. The wine will cause you drowsiness, dizziness, fuzzy memory, and the slurred speech. And it has the long-term impact on the balance, on coordination, memory, emotional, and body temperature. Dangerous when mixed with medicine, that we all know. Smoking and related risks. I think we can pretty much skip that, and that's been said for many times. Some medicines can affect the way your brain functions. Talk to your caregiver about prescription and over-the-counter drug interactions, memory and brain function side effects, whether your medicine can affect your sleep. All these are important things to have. And in the first hour, when we talk about your aging and dementia, there is that one list of all the questions that you should ask your physician. That one is very good. If I remember, I'll try to copy that page. So when you use that as a reference when you go to see your physician, especially when you get a new prescription drug. The health condition that can affect your brain health. These are the common ones: the heart disease, stroke, high blood pressure. We all know that stroke, a lot of times after stroke, you have some mini stroke that you don't even know. You're not aware of it. But if you ever get scan on your brain, you will find out, the doctor can tell that if you have a mini stroke before. The mini stroke that you may not know, but can already affect your memory. So make sure that, I mean, if you don't know, you don't know until you get a scan. But if it doesn't affect you for the daily activity, it's probably okay. But just keep in mind, the heart disease and the stroke and the high blood pressure, these are the most important parts that we all wanted to make sure that we have them under control. Diabetes is the next one. In a rich country, like in the United States, diabetes rate becomes higher and higher. And I have mentioned many times that Asian American has higher diabetes rate than the non-Hispanic whites. Compared to the average white Americans, we do have more diabetes. And if you have sleep problems, try to find different ways, trying to sleep as much as you can. If you still have problem, look for professional help. Hopefully that all of us will get enough sleep and keep our daily activity sharp. Okay, how do you prevent the heart disease? Manage your cholesterol, control your blood pressure, eat healthy, quit smoking, limit alcohol, limit exposure to air pollution. That sometimes you cannot control, but yeah. Just avoid to go into the air polluted area, the big cities. All of these we have heard so many times, and basically for any heart disease, you just have to control what they call the metabolic disorders, which include high blood pressure, cholesterol, diabetes, A1C, your circumference, your waist circumference has to be within certain inches, okay? And you have all these under control, you have less chance to get any of these disease. The cholesterol, if you have one of these 5 parameters that's slightly higher, 2 of them not over the threshold to be called either high cholesterol or high blood pressure, but you have 2 of them at the pre-level, the doctor will drop the standard. Then they may ask you to start taking medicine, especially statin has been proven such a good drug to help people in many ways. So I don't know if it's a doctor's recommendation now or is a pharmaceutical keep pushing. If you go into any checkup with your physician, some of them will probably push you to start taking, even though you didn't have real high cholesterol or high blood pressure. But if you are above 120 and with a cholesterol like a 210, they will probably ask you to take the statin. That's the protocol these days. So it's up to you whether you want or not. You can discuss all these with your doctor and get a second opinion if you're not sure. Diabetes, which is especially the type 2 diabetes, is definitely something you can have it under control. I just, I'm so happy that I had a chance to do the diabetes prevention programs, which was one of the most successful program I ever run. That I had a few diabetes that after 1 year of this training, they reduced down to pre-diabetic level. So yeah, diabetes definitely will affect your memory, increase your memory problem and Alzheimer's disease. And all these have been discussed many times. Sleep problems. Common disorders, sleep apnea and insomnia, narcolepsy, restless leg syndromes, all of these. I don't know how to advise people who have sleeping problem. I do know some friends have that issues. A lot of people say that meditation these days can help. And there are some meditation therapy that people use, different kinds. I think Dan Harris, an ABC newscaster, he even had a special program that I have a friend taking that. with him. It's like a 16 weeks or something that they do that, supposedly helping you to sleep better. I don't know if it's helpful. I have not personally encountered that before, so I cannot advise you, which is not mentioned here. But if someone is a smoker, quit smoking may help, that's for sure. Any relaxation techniques hopefully can help. Dementia usually involves buildup of harmful proteins in the brain, the death of brain cells, and loss of connectivities among them. Remember the alcohol that will break a lot of the neural connectivity. That's one of the issues with alcohol. And the protein that build up in the brain, some of them will really be bad for you. But the risk, age, genes, or in some people, or head injury definitely, or stroke. The approach: exercise, eating healthy, and control high blood pressure and heart disease, and cognitive brain training. This is what we're all doing now. Where'd you start? Schedule a health screening or physical exam. Review your medicine with your healthcare provider. Add daily servings of vegetables to your diet. You've already eaten a lot of it, add one more serving of vegetables. Thought of food, activity, or health journal to know where you have been, how do you eat, and all that good stuff. Find your community and engage some activities in there. That is to improve your social connectivity. So any way you can improve your social connectivity is helping you too. Okay, that's the all good thing. I didn't go over time yet. Okay, still have 5 minutes. Anybody has any question or comments that you